Good morning, afternoon, evening. Thank you for joining us for today's forum. I'm Pat Mitchell, co-founder along with Rhonda Carnegie of Connected Women Leaders. This is a community of transformative change leaders who are committed to sharing learning and collective problem solving. We gather together like this to address the world's global threats, and our urgent threat for today's forum is food insecurity. Hundreds of millions of people suffering in a food ecosystem that was already under threat and increasing stress because of the COVID-19 pandemic. Thank you for joining us for this opportunity to elevate the issue and to do some just and sustainable solutions. Our partner in this work at the Rockefeller Foundation, please welcome Sunday Bridget Jones.
Thank you so much, Pat, and welcome to everyone joining today. I am quite grateful on behalf of the Rockefeller Foundation to be together with Pat Mitchell from Connected Women Leaders and with Michelle Nunn, the president of CARE, for this event. I just wanted to say that we have been working with Connected Women Leaders over the past couple of years with a view towards really supporting networks of women leaders on the frontiers of change with a real promise to foster evidence-based, equitable solutions for problems like food insecurity. And so I'm quite delighted to have this forum today to hear from all these amazing women and the work that they are moving forward. So with that, thank you, Pat, for allowing us to be a part of this effort.
Sunday, I'm going to jump in and say it's a privilege to be with both you and Pat. This is an extraordinary group of women, and also an extraordinarily important topic, as I think we will see as we get into it. But as I think many of you all already know, if you think about the challenges the world faces, which are many, there are none that are more important than the fact that we have 690 million people right now who are chronically hungry or undernourished, and that number is anticipated to grow. It has been growing in a reversal of progress. And we know that the COVID pandemic is threatening and significantly exacerbating these issues. And we know also that hunger disproportionately impacts women. And so if you think about the trend lines we're talking about, ensure that we have more hungry people who are getting hungrier, and more of them are women. And we also know that women and women's equality could be one of the very most important factors towards our ensuring that we could feed more people. So it is a part of the solution. CARE, as many of you know, works in 100 different countries. We've stood up a pandemic COVID response in 67 countries right now. And of that work, we have reached, just in the last few months, over 11 million people, and have 1.2 million have been around this issue of hunger and nutrition. So we know firsthand how important this is. We have an extraordinary group of folks to help us explore this issue. And we have a really ambitious agenda. And so we have the opportunity to hear from some of the foremost experts in the world, starting with Dr. Agnes Kalibata, and then going into 2 panels with an amazing set of both practitioners, thought leaders, and policymakers. And then I think we really wanted to make sure that this was not just a learning session, but this was a call to action. And so we're going to have some opportunity to really think about what can we, as a set of influential leaders, connected women leaders, connected men leaders, do to ensure that we are creating a more equitable future and that we are addressing global food insecurity in a really profound and important way. So to just ground you, I think, in the importance of this issue again, let me just highlight that many of you all know that the Sustainable Development Goals are what's guiding us in terms of progress for the planet. And there are 17 goals, and it is inextricably true that they are all linked in some sense to food and agriculture. And without going through the radius here of these 17 different dimensions, I think you can see that that profound to our ability to reach these 17 goals is our capacity to ensure food security for the planet. There is no better person to guide us on the journey than Dr. Agnes Kalibata, and to give us a introduction at the broadest sense to the context of what we're needing to address here. So Dr. Kalibata is the United Nations Special Envoy for 2021 Food Systems Summit and the president of the Alliance for Green Revolution in Africa. Many of us know that as AGRA. She is the former Minister of Agriculture in Rwanda. She herself comes from a family of smallholder farmers, was a refugee in Uganda. And in addition to, if I read you the list of honorifics, it would take the rest of the hour and a half. But in addition to all of the things that she's accomplishing, I understand, Agnes, that you also are managing two twins. Alongside of all this. So the extraordinary leadership that you're bringing to bear here is really appreciated, and we would love for you to guide us at a macro level, setting the stage for our conversation, and maybe in particular picking up on what you're looking for from the Food Systems Summit and how that might propel us into the future.
Thank you, and really happy to be part of the Connected Women and women in leadership today. I really appreciate the introductions you've given, but also thank you all for inviting me and having me as one of your discussants. Now, in this COVID crisis, and you did highlight a number of the issues we are looking at, Michelle, but I just wanted to highlight that given the COVID crisis, another 135 million people are being thought of as people that might fall through the cracks with regards to hunger, adding the numbers of people that are hungry that would have otherwise survived hunger. Already we have about 1.6 billion people that have fallen out of jobs that were part of the informal job sector that definitely are suffering because of that. A significant proportion of this definitely is women. When I look at West Africa, one of the earliest calls I got, because in the work we do, we support SMEs. One of the earliest calls I got. In West Africa, we do have a strong set of SMEs that actually are huge and busy in the food sector between the farmer and the folk. And this group of SMEs is extremely important, but it was also part of the group that was earliest affected, given what was happening with COVID. So the impact of COVID on women is huge. And I would just want to give you a few statistics. We did, because we were concerned, my job, the job we do at AGRA, is to strengthen SMEs in the agricultural landscape. We don't necessarily work directly with farmers. We do recognize that we need to set up a viable and sustainable system, and we actually work to strengthen SMEs in that landscape. So we were extremely concerned around what is happening, and we did look at SMEs and what is going on. And we did find that 60% of women-owned SMEs were already looking at significant losses as a result of COVID, and another around 37% were already closing. And why were they closing? Issues of cash flow, issues of being able to access funding in an environment where, in the first place, setting up a woman SME is a challenge, but also surviving that environment when challenges become many, like COVID has done, then women SMEs start suffering the most. We did find out that many of them were considering closing within 6 to 12 months. And for me, that is an extreme challenge because, again, it takes so much to get a woman-owned SME off the ground. And to see them close is just so much of what we talk about with regards to erosion of the work we've already done. That's probably the best case scenario where you see all the wins and gains being eroded. And they were very clear on a few things they needed, those that we are still in, that they needed. The thing they need the most, probably more than anything, is advocacy. We all need to raise our voices and really probably make these calls more often than we are doing now, and just make sure that everybody's hearing and understanding what is at stake with regards to these businesses in the agricultural landscape in the first place, but also then to women-owned and female-owned businesses. What do they need? They told us the things they need. They need digital tools that will allow them to connect with or without ability to move. They need operational costs. They need online marketing services, and they need an opportunity to and digital services would help them with that, an opportunity to venture into new markets as our world is being redefined. They need an opportunity to be able to do that. So here we have an opportunity to again engage and really provide leadership and support them the best way we can. I just wanted to move on now to the food systems perspective and recognizing the time, and just say that even before COVID, we knew very well that our food system was not sufficient for us, and the people that are impacted the most are women. Women, because women feed our children, like you said at the beginning, women feed our children, but also when you look at the people that are in farming, 45 to 65% of women that are in farming get their livelihood from farming. So the impact of climate change and what was already going in there impacts women the most. The impact on nutrition, we know that in nutrition, poor feeding is the #1 cause of death. The stigma of seeing your child become malnourished, the stigma of not being able to feed your child is felt the most by women, but also the dealing with the disease burden is felt most by women. So yet we still don't have very good gender segregated data. Yet we still have issues where a woman trying to start a business needs collateral here and there. Yet we still need someone to step in to ensure that a woman-owned business has an additional person that will ensure that that money is secure. They are not enough by themselves. Yet we still have that family phone owned by a man and a woman hardly having access to that phone when it comes to that. So really, as we move forward into the SDGs, as we move forward to secure some of the things we care about around nutrition, around food, around maternal and health and child health, we really need to look at how these things place the biggest burden on women, including education. I was looking at young girls the other day that can't have an education today because they don't have online services. It's the mothers of those children that are spending sleepless nights thinking of what they are going to do next. So I wanted to encourage you.
Yeah, thank you. I know you were just about to start to give us the close. Thank you. The call to action.
So, in closing, we have an opportunity as women leaders to raise our voice. We've been given, to whom a lot has been given, a lot is expected. That is what I want to leave with you. You know the odds, you know what these women are working against. We need to raise our voices and make sure that they are being heard. Thank you.
Thank you. I think you pointed to the importance of the food systems at a macro level, but also so acutely pointed out both the needs and also the import here. So thank you for all the work that you're doing. And it's my pleasure to now hand this over to my partner at CARE, Jada McKenna, who is has her own wonderful history of leadership here, has been a part of many of the institutions that you all represent over the course of her career, has helped been an architect of Feed the Future, and is so you are in good hands in her moderation and leadership. So Jada.
Thank you so much, Michelle. It's really an honor to be part of this operation today. We have a wonderful lineup of people here to talk about the landscape of food security, what's important, and what they see as what we should be focused on going forward. As Agnes just told us, we all have an opportunity to use our voices, and so I'm going to turn it over. I'll introduce some of the panelists and turn it over so we can see what they're seeing from their perspectives on the issue and different places where we can use our voices. Our first speaker will be Ndidi Nweli, who is the managing partner of Sahel Consulting, Agriculture and Nutrition, a co-founder of ACE Foods, and a founder of Leap Africa.
Delighted to be here, and thank you so much, Jada, and to the wonderful women who have convened. I am just so passionate about the food and agriculture landscape and believe that oftentimes when we think about this landscape, we zero in on rural farmers. But actually, this landscape is extremely complex with multiple actors. And there are lots of external drivers, from climate change to globalization and trade, urbanization, population growth, politics and leadership. And when we think about the chain, it starts all the way from inputs to the fork. And when we think about the environments that shape it, it's about the availability of food and the affordability of food, as well as individual factors such as habits and economic issues and consumer behavior and diets. And I think it's really important that we frame our discussion in a very holistic manner, understanding the complexity. Now, when we zero in on COVID-19 and the food ecosystem, what shocks us is that it's not just the health pandemic that we all share as humanity, but it's also this food pandemic. When COVID-19 entered our biosphere in African continent around March, I wrote an article saying, how can we ensure that COVID-19 doesn't kill more people through hunger than a health issue? Now, when I looked at the headlines, I was shocked to see that this same fear was being manifested in other parts of the world. Even earlier this week, the UK reported that 2,500 children were hospitalized with malnutrition, double the number from the year before. Asia is banning food exports. Europe continues to have panic buying. The number of people who are malnourished is doubling in many parts of the world. And this has become a huge challenge because of school feeding programs being closed, when schools are shut down, and job losses, they decline. So it's a widespread problem. Now, when we zero in on the role of women in the agricultural landscape and how this pandemic has affected them, it's also a very complex issue. And we have to look at the role of women, because oftentimes we focus on women just as primary providers of food or processors. And we neglect to realize that women play an important role in input production. They also have a role to play as SMEs, as Dr. Agnes has talked about, but as traders, as extension workers. And the reality remains that only in my country, for example, only 10% of the land is owned by women. We don't see enough women in logistics. We don't see enough women in aggregation and distribution. So the system is skewed in a lot of ways because we have women really at both ends of the spectrum, primary production and retail, where the margins are extremely low. And so when you have an issue like COVID-19, a shock that rattles the ecosystem, it reveals some of the challenges that existed before, but also exacerbates them. Now, zeroing in on what we are learning from COVID-19, we see that it's showing us, number one, that we have a challenge around credible data, around gender outcomes, around food markets, around the social safety nets. Many of our countries have very poor grain reserves, disorganized markets. Our ecosystem is so fragmented with actors working across each other instead of together. And now that leads me with us thinking about the next 12 to 18 months. This pandemic is going to be with us for quite a bit of time. And how are we going to address it? How are we preparing for it? How are we managing it? And that's why this call to action is really critical. And as we start this conversation, I want to zero in on what we need to be thinking about with women and food. First, the assets that the women have, their skills, their financial support, the inputs, the market intelligence, the market linkages, a lot of these issues that Dr. Kalibata underscored. But overarching is really the policy and legal environment. And that's why I think more than ever before, we need business leaders working across the board, thinking holistically about how to solve these problems, working side by side. Now, it's not just an issue for those of us in agriculture, but those of us in financial services, policy, across the board. We need all actors to work together. So I'm really excited to hear from all my sisters on this panel, because I believe collaboratively we can address this problem and we can begin to think about solutions. Thank you very much.
Thank you, Ndidi. We will turn now to Jillian Pays, who is a partner at McKinsey & Company out of their Nairobi office, and she also leads their African agriculture work. Jillian?
Great, thank you so much. So I have the great pleasure of actually leading McKinsey's agriculture practice in Africa and working at the intersection of governments, donors, and private sectors overall. And when this crisis hit the continent, we saw sort of a play out in terms of those sort of three different sectors in terms of what happened. On the one hand, when you talk to the private sector, you hear very much that things have kept moving. Actually, they've been quite pleasantly surprised. Borders have largely been open, sales have proceeded, things have kept moving, is sort of the phrase we keep hearing over and over again from the private sector. But then, of course, you've got the hit that is probably coming now, and we're starting to see more and more, which is the shock on affordability that Ndidi and Dr. Kalibata talked about, which we didn't see immediately, but we are now starting to see more and more come through. And now just rising concern from donors and the government around how to address the looming food insecurity and lack of affordability for food. And more now the private sector also recognizing how that's going to impact them. With some anecdotes I'll give you, for example, sort of a 20% reduction in purchase of some food categories actually seen in Kenya quite recently, which was quite surprising to many of the food players, and possibly driven by this affordability issue. Now, when of course we talk about women in the context of this challenge, a couple of things have played out on the ground that I'd love to share and think through then how do we think about addressing some of these issues. So beyond the affordability issue that Ndidi and Dr. Kalibata have talked about, we've seen closure of markets happen. And part of it due to sanitation protocols, part of it due to lockdown measures. And if you had a chance to read Ndidi's slide right before this, you'll see that women are more present in terms of retail, including selling food in many of these markets. And the closure of markets, therefore, disproportionately can affect women's ability to access income, especially through sale of products such as horticulture or fish, which we've seen very much in many markets in Kenya. The second impact, of course, is the children being at home and no longer, as Dr. Kalibata mentioned, no longer having access to school feeding. In a recent survey that was done in Kenya, 67% of women said their biggest concern on having their children at home was being unable to feed them. And in contrast, that concern was only shared by 54% of men. So you see the disproportionate concern of women towards feeding their children with school closures, which in Kenya, where I'm sitting, are now looking like they will be closed all the way into January and potentially beyond. So quite a significant gap there. And then the third thing we should also recognize is globally, there have been disruptions to very specific value chains in the food system, which may also disproportionately impact women. And one example that springs to mind, again, I'm giving a Kenya example because that's where I sit, is the collapse of the flour industry that actually happened due to COVID, due to lockdowns in Europe, and then a cessation of basically passenger flights in and out of Africa, which put 70,000 people out of a job. And many of those, in fact, a disproportionate number of those are women, because it's the women who actually harvest and produce many of these flours in these commercial farms. So you therefore saw probably a large chunk of women who are actually formally employed in agriculture losing their jobs due to this very specific impacts on certain value chains. So I think in conclusion, just picking up on Ndidi's points, it's a very complicated system and the role of women also quite complicated along the chain. But there are certainly very specific things we need to think about in terms of how markets will evolve and how do we ensure access to markets, particularly for women with this ongoing disease continuing. What are the disruptions to specific value chains that actually impact women more than others? How do we in particular address the issue around school closures and the disproportionate burden that places on women in terms of supporting their households? Thank you.
Thank you so much, Jillian. We'll now turn to Vicki Wild from the Bill and Melinda Gates Foundation. Vicki is a Senior Program Officer of Global Growth and Opportunity in the agricultural development and women's empowerment space. And I would also be remiss if I didn't mention that Vicki was also the founder of Award. For those of us who've been in the space for a while, we will know that fondly. Vicky?
Thank you, Jada, and so good to see you again. And let me start by pointing out that much of our work on women's empowerment at the Bill and Melinda Gates Foundation counts on the partnership of many of the women leaders on this call with us today. And I just want to start by saying thank you. At the core of the Bill and Melinda Gates Foundation's work is a core belief that all lives have equal value. And in recent years, we have turned our focus more intentionally on addressing root causes of poverty, hunger, and inequality, particularly as experienced by women and girls. We do believe that an equal world is a greater world. But few nations have achieved meaningful reductions in poverty or food insecurity without first transforming their agricultural systems, which is why our partnership with Dr. Kalibata and AGRA, for example, is so important. We put a strong focus on increasing the productivity and incomes of smallholder farmers. Agriculture also plays a prominent role in our gender equality efforts. In sub-Saharan Africa, South Asia, up to 40 to 60% of the poor farmers, livestock keepers are women. And we focus on what they need to sustainably produce an abundance of healthy, nutritious food and to generate income. And that includes access to improved crop varieties, fertilizer, financial services, technical advice, and access to markets. And while many poor farmers, men and women, are challenged to obtain these services, the data tells us that women face disproportionate constraints. Take, for example, Ethiopia, where about 60% of women work in agriculture. Differences in the simple averages between men and women show that women lag men by 36% in their agriculture productivity. And this gap is underpinned by the fact that women farmers in Ethiopia are 40% less likely to interact with extension services, 30% less likely to live in a household with access to credit, and 13% less likely to have access to improved agriculture inputs. Closing these gender gaps in agriculture alone would generate an additional $1.1 billion to Ethiopia's economy annually. At the Gates Foundation, we try to be crisp about what we're solving for. And in our agriculture team, we aim for two things. First, we want to increase rural women's incomes, and most importantly, we want to increase their decision-making over the benefits of that income. The beauty of economic empowerment interventions with a focus on women is that they have huge spillover effects. Directly, these interventions reduce poverty and increase food security. Indirectly, they encourage women to expand their sense of self and challenge the unwritten rules that say that women are lesser than men. With the COVID-19 pandemic, this work has become all the more urgent. And first, let's all give thanks to the farmers who are producing the food, and thanks to all the workers across the food supply chain that keep the food moving to where it's needed. But the disruptions to the food markets caused by the pandemic indicate important vulnerabilities that could prompt a global food crisis. Now, hunger and malnutrition were significant global problems before the pandemic. According to the UN's Food and Agriculture Organization, FAO, more than 2 billion people last year did not have access to sufficient food. Some 704 million of them went to sleep on an empty stomach. And Africa today is bracing itself for more to come. A catastrophic locust outbreak in East Africa, pre-pandemic, projected to force 25 million people in Ethiopia, Kenya, Somalia, Uganda to go hungry. A swarm covering just 1 square kilometer contains 80 million insects and consumes more food in 24 hours than 35,000 people. Africa, south of the Sahara, also faces its first recession in 25 years and especially vulnerable to the impact of the COVID-19. And the jobs most at risk, as pointed out by Dr. Kalibata and Ndidi, are in food processing, services, and distribution, disproportionately affecting women workers. In other words, this pandemic is not only biological, it is social. It exploits the pre-existing conditions of racism, the pre-existing condition of sexism, poverty, and hunger in the same way that it exploits the pre-existing conditions in our bodies. This crisis is threatening livelihoods, especially women's. And to fully recover from this pandemic, leaders must respond to the ways that it's affecting men and women differently. And if they don't, they risk deepening this crisis and rebuilding the world with all the same social cracks and economic fault lines as the one before. If, however, policymakers use this emergency as a chance to do things differently, countries can build back better, more prepared, and more equal. Thank you.
Thank you so much, Vicki. Before I go ahead and formally introduce Christina Doherty of PepsiCo Foundation, we want to introduce a short video that showcases some of CARE's work in our partnership with PepsiCo and the critical issues we're addressing today. I think there might be some issues with the audio. I know the team is working to correct that.
Abakazi ko turi kurima ibyo kurya bigasira amaka gitu abana babone school fees.
Abashaija balima batarafa okuherera abaana bitu nindeeba abakazi ko bari kubahika abakazi ko bari kwija babahisa enshonga zabo z'amaka.
Thank you, that's great. I would now like to introduce Christine Doherty, the VP of Global Sustainable Agriculture and Responsible Sourcing at PepsiCo, the company, not PepsiCo, the foundation, as I misspoke earlier, although obviously the PepsiCo Foundation is related to PepsiCo, the company. So thank you, Christine. With that, would love to hear your remarks.
Thank you, Jaden, and thank you, Pat. PepsiCo and the PepsiCo Foundation, we're both honored to join today. As we've heard, while food and agriculture can be a powerful driver of development, too often farmers and especially women in agriculture still experience poverty and food insecurity, especially now with COVID pandemic. You may not think of PepsiCo as an agricultural company, but agriculture is at the heart of what we do as one of the largest global food and beverage businesses around. PepsiCo sources more than 25 key crops across 60 countries and supports over 100,000 jobs throughout our agricultural supply chain. We know that our actions, given our scale, reach, and expertise, can have a significant impact on the world we live and give us the opportunity to help make the vast food system work better. Let me tell you about a few of our programs. Through our sustainable farming program and promotion of our demo farms, PepsiCo is working with farmers in diverse growing regions around the world. What's farmed and how it's farmed depends on local geography, climate, and culture. We work with smallholders and large-scale farmers around the world to test locally relevant, sustainable approaches to water use and soil health, such as drip irrigation and digital technologies for farm management. One of the key aspects within our Demo Farm program is the concept of sharing. Sharing practices and technology is the key to widespread adoption. We invite nearby farmers, even if they do not grow for PepsiCo, to the demonstration farms for field days to see techniques, tools, and results firsthand. This peer-to-peer idea sharing helps accelerate positive change with greater scale. Together, we co-collaborate to find what works best for their particular geography and crops, and then we help the farmers implement these approaches. These results can include efficient water and fertilizer use, healthier soils, increased crop yields, and profitability. We know empowering women in agriculture is a key driver needed to progress toward a more sustainable food system. Women in agriculture and the supply chain can improve livelihoods, promote resiliency in farming communities, and increase adoption of sustainable practices. Women's contribution to global agriculture are often overlooked and underappreciated. Women make up 43% of global agricultural labor force and are responsible for the vast majority, nearly 90%, of household food preparation. According to FAO, if women farmers had the same time and access to resources as their male counterparts, women's food production would increase by 30% and help eliminate hunger for 150 million people. PepsiCo is working to engage women in our direct supply chain and through partners such as CARE. The PepsiCo Foundation is investing over $18 million to scale CARE's She Feed the World program in over 6 countries and will impact 5 million smallhold female producers and their families. This grant will provide 5 million women farmers and their families around the world with education, resources, and economic support to help them increase crop yields, incomes, and improve family nutrition. Specifically, She Feeds the World will help women gain access to land rights and improve their access to markets. The program is also designed to provide training to men and boys to address culture and societal barriers to gender equality. We're very proud to be part of the largest sector partner of She Feeds the World's program of CARE to date. In closing, investing in women farmers and addressing this imbalance is not only critical for women, but is a crucial pillar for creating a more sustainable food system that benefits everyone, and PepsiCo is proud to be part of the solution. Thank you, Jaden.
Thank you so much, Christine, and we're so thrilled that PepsiCo is part of the solution. I'm pleased to introduce Devin Clattel, who's the Managing Director at of the Food Initiative at the Rockefeller Foundation, where she looks at both global and U.S. domestic issues. Devin?
Thank you so much, Jada. And thank you to CARE and Connected Women Leaders for having me today. It's a real privilege to be on this panel with so many thinkers that are speaking to this issue globally. The Rockefeller Foundation's Food Initiative also works globally, but for this conversation today, I'm going to focus on the nutrition security crisis that we too are experiencing here in the United States. And I wanted to start by just showing one chart for folks that might not be familiar with the data that we're seeing in the US. But here in the US this spring, we have seen every measure of child hunger at a level that we have never seen before, the highest level in decades and the highest level that we've seen since we've started collecting data via this survey for more than 20 years. And In April, as you can see here, the US Census found that nearly a third of households with children were unable to buy the amount of quality or food that they wanted. You can also see on this chart that mothers with children, particularly young children, disproportionately suffer from nutrition insecurity in the United States. And what isn't shown on this chart, but is equally galling, is that the rate of nutrition insecurity is much, much higher among Black, Indigenous, and Hispanic populations in the US, up to 2 to 3 times higher than in white populations. And so nutrition security in the US too is a gender issue. And you know, we've seen some important learnings from this spring's COVID crisis and the economic fallout that has subsequently taken root in the United States. As many people on this call will probably recognize, in the US, it's not that we lack the supply of food or food production. It's that we need a more integrated nutrition security system to reach the populations that are unable to access or unable to afford healthy and nutritious food for their families. And I just wanted to share 2 reflections today of things we are thinking about with our partners and working on during the crisis. The first is that the crisis has really made stark the connection between food and health and nutrition and health. 94% of deaths from COVID-19 are among individuals with an underlying health condition, and the vast majority of those conditions are diet related. And generally the sense is that if we had a healthier population in the US, we would see less devastating effects from this virus. And so we absolutely need to integrate food security and nutrition security into our healthcare system and as part of health provision in this country. The Rockefeller Foundation is supporting a number of programs that do this through incentives like produce prescriptions, which is a program where a family can go to their healthcare provider and actually get benefits to be able to purchase healthy food. But that's just one of many ways that we're asking the health sector and health allies to step into the nutrition security space. And the second learning is one that, you know, sounds really universal hearing from my other panelists, which is that schools are anchors of community nutrition. And that is true in the United States as well. When schools closed this spring, we really saw the bottom fall out in terms of the nutrition security rates. And we at Rockefeller are directly supporting school nutrition programs and districts that are serving millions of meals, continue to serve millions of meals as schools are closed. But that is a fraction of the number of meals that need to be served to children that aren't able to purchase healthy food on their own. And we absolutely need public programs to be expanded and extended in this moment to make sure that programs continue, even as school closures are forecasted to be sporadic over the next year and beyond. And the last point I'll make is that, you know, women play a leading role often within a household and within a family in both health and education. I think at this moment in the US, there's a very active dialogue around the vulnerability of women who are trying to balance childcare and taking care of their families with, you know, unemployment rates that are skyrocketing and sort of professional pressures. And we need to make the nutrition security system here easier to navigate and one that can deliver nutrition with dignity and one that delivers, you know, a client and family experience in navigating that system that is easy, that is data and technology enabled, and that respects the sort of cultural appropriateness of the different communities that we have in the US. So I'll just close by saying, I think this is the moment. The COVID crisis did not create these problems in the US, and ending the pandemic will not solve these problems, but we think that there's a unique moment in time where we have both the urgency and the opportunity to address a lot of these systematic deficiencies that disproportionately affect women and particularly female-led households in the US.
Thank you, Devin. We are going to come back to this panel later at the end to hear each of your calls to action. But before we do that, we have a few more speakers who are practitioners that we want to hear from and understand their experiences on the ground. I will start with Maureen Muruka, who is my colleague at CARE and is the Director of Gender, Youth, and Livelihoods. Maureen?
Thank you, Jada. I'm extremely honored to be part of this panel today. I'm speaking from Nairobi, Kenya, which is where I am based. And as you know, the previous speakers have said, The worst that we feared with COVID is already manifesting, in this part of the world. And CARE is following on this very keenly. We first conducted a rapid gender analysis, over 3 months ago. We have since updated that with new data, and it's really showing us one of the things that we really are continuing to do is to put gender equality at the center of the response that we are doing. And the new data is showing us that food, income, and rights that includes gender-based violence are top on the priority of not only women, but also men. But I'd like to say that food, income, and issues as we are seeing as gender-based violence are very, very interrelated, because we know that a lot of rural incomes are from the agriculture sector, and that household decision making and on income allocation and all that does lead to gender-based violence. We've also heard that women's burdens are increasing in the agriculture sector. Their caregiving burdens are also increasing. And our data has also shown us that women are approaching the end of their safety nets. And so the work that we're doing right now in CARE to intervene is under the She Feeds the World program framework that you have just seen the video about. The video on, and we are using this framework to adapt our responses in the field to the realities of COVID at the moment. So we are saying we have to scale up safety nets. A lot of governments are rolling this out, but do they include women? Are they gender responsive? As Dr. Kalibata said, are we paying attention if we are doing unconditional cash transfers on who holds the cell phone within the households, and are the meals that are people getting balanced? So with our PepsiCo program in Egypt, we are giving out hot meals, and so far have done about 40,000 meals over there. But also you find that most emergency responses leave out seeds, animal feeds that are also required to keep food systems going during crisis. And so in Peru, we're already seeing results from our PepsiCo program indicating that giving the seeds and the animal feeds is making households better able to cope with the pandemic. So we need to continue to influence the policy and the government to ensure that safety nets are gender responsive, and they are taking into consideration the needs of women. And we also, previous speakers have alluded, to markets and to extension information, that farmers continue to have financial services. Our village savings and loans associations form also the safety nets that women very reliant on, but they're not able to meet. Women rely on face-to-face interactions, and these have been interfered with, of course, by social distancing and all that. So we are moving more into the digital space and adapting our programming. In Uganda, we're even recording DVDs. We're using WhatsApp messaging in a lot of the countries that we are working in. And actually, we are realizing that about 60% of farmers in Peru have smartphones. And for those who are not able to access WhatsApp messaging and all that, we are also working with the media and radio and being able to to reach women. The question for all of us and development practitioners is in the future to see how these are working, especially for women, and how it interacts with asset ownership within the households. And so we are adapting our approaches, the Farmer Field and Business School that was developed with funding from the Bill and Melinda Gates Foundation, our partners, PepsiCo, Cargill, General Mills, Mars, and all the other development partners that are working in have bought into these models and have invested in them. And we do need to continue to, have invested in this model, and we do need to continue to do so, because gender transformative programming requires that we bring in the men and boys, as Chris mentioned before, and we need to continue to co-create together to continue to put women at the center of our response.
Thank you
so much.
Thank you so much. Ndidi Nweli, I mentioned when I introduced her earlier, she wears many hats. And so we're thrilled to welcome her back to this panel to talk about what she's seeing from entrepreneur programs that she's running. Ndidi?
Thank you so much, Jada. So I wear many hats, and one of them is actually as the chair of NourishingAfrica.com, which is envisaged as a home for 1 million entrepreneurs in the food and agriculture landscape. Now, COVID-19 has been a mixed bag. About 50% of our entrepreneurs have had to close down operations temporarily with fears that they might not open. The other 50% have actually experienced tremendous growth and increased demand for their products and their services in the food and agriculture landscape. And this has led to a few revelations, which I'd like to share. The first is the critical role for shaping policy. And women have to be at the forefront of all interventions. And I'll give you my own personal example. When the government decided to lock down our cities and interstate travel, I've quickly reached out to the Governors Forum and found out that they had excluded agriculture and food as essential. So they were basically going to lock down the food and agriculture landscape. And we had to quickly write policy in to make sure that farmers and all the actors across the value chain were considered essential. This has now cascaded into many new initiatives where we're helping to shape policy. And I think we have to be more deliberate about ensuring that female voices and women are at the table. The second key issue that has come out is the lack of gender-focused data and data in general. And the entrepreneurs that have been able to pivot quickly are those who've been able to leverage what they can see and what they hear in their environment to pivot. And this has been extremely helpful, the need for data. And then the third key insight for me and the key lesson is the importance of short value chains and local sourcing. We have seen that for our ecosystem to really thrive, we need to source locally. Ace Foods, a company I co-founded 10 years ago, has experienced a doubling of demand. For all the importers who used to bring in spices, they're now sourcing from us because of COVID-19 and the lockdowns. And this has actually helped our farmers and helped all the SMEs in our value chain. And this shows us that as women, we have to push for local sourcing policies. And I actually learned this from Therese, who is on the line, that Brazil has this local sourcing policy. And Nigeria, I've been pushing for a 60% local sourcing policy to demand that all our multinationals and key institutions source locally. That way we unlock all the potential and ensure that we invest in R&D and support our farmers. So I think for me, COVID-19 is a mixed blessing for the Nigerian ecosystem and for the West African ecosystem, because it's shown us what is possible, it's shown us that we need to take charge, and it's pushed us to really, really get angry enough to make a difference. And coming out of this, I'm convinced that we're building back better, that we're going to build back an ecosystem that's stronger, where we're more empowered and we're more resilient and ready to shape policy, but also work across the board to empower women and ensure that women SMEs thrive and can respond to future shocks, because there are going to be other shocks post-COVID-19. And how are we going to respond? And so I'm looking forward to the call to action. Thank you very much.
Thank you, Ndidi. I'm thrilled we have 2 more practitioners with very unique lenses on things. I want to first introduce Teresa Kirkau, who is a chef and social activist and from Brazil. Teresa.
Yes, oh, it's really, really a privilege to be here amongst such a wonderful women. Well, I'll tell a little bit about my journey as a chef. I'm a designer formerly, but I've been a chef for almost 40 years. I started really early, but at the beginning, 20 years of my restaurant, I only did, normal cooking, like family dishes and all that. So in 2001, I joined the slow food movement. And because of that, I had my aha moment as the place of a chef in the food chain. Because before I thought, well, being a chef, you are an entertainer almost. And after that, I realized there was many issues that I should pay attention to. And the first of them was identity food. So I realized that as a colonized country, Brazil was also colonizing its eating habits. So I started to develop this interest and curiosity about what is my identity food? What is the Brazilian identity food? And I came across, by chance, to manioc, cassava. So in the poorest parts of Brazil, especially in the Amazon zone, cassava and manioc is the staple food, and used to be the origin of cassava, although Nigeria is today the largest producer. So I made a small documentary about how to make a cassava flour. And because of this documentary, I started to understand the passion that linked chefs and small farmers, smallholder farmers. It was like a love affair. And from that little documentary that was only to present in a convention, I started to understand that we were partners and we could work together. So I came back to Rio and I started a little group, and I called them Eco Chefs. And we start making eco gastronomy, which is a gastronomy not only for the people that can afford to go to a fancy restaurant, but also to change people's habits and to change and to advocacy, to make advocacy for smallholders as well. So we are kind of double-sized people. We work for the farmers as well as for the consumer. We can listen to them and understand that we have tools, not only cooking tools, but communication tools. We are influencers today with the social media. We can also help them to go through the difficulties to reach, the public policies. And Didi was talking about those two public policies that we have in Brazil. Very, very interesting, very, very clever. That were the public policies. It's called PAA and PNAE. The first one is the public policy to procurement for all public places, like hospitals, prisons, schools. So someone thought that if the government needs to buy food for the public places, why not buy from smallholder farms and fishermen? So now is a law, for 10 years has been a law, that all public places have to buy up to 30% of all their procurement from smallholder farmers. So of course it's not completely achieved yet. In some places of Brazil, now it's 60% of what they buy for government comes from smallholder farmers. But in other places, like in Rio, my state, unfortunately, we don't even have 10% of that. So what I believe is that chefs are the lost link between producing and consuming. And we saw here some people talking about the need to change eating habits, consumer habits. This is not an easy thing to do. We are colonized, many countries in the south of the earth are colonized and have been completely changed their diets from that colonization process. So I think we need to do more than just beautiful TV shows or nice recipes and delicious things. I think we really have a power to change that and to find, indigenous crops, indigenous, very high in nutrition. I have here a book of, like foragers. There are foragers in England. There are foragers in Brazil also. This book is like a Bible of herbs, very high in nutrition. But if you oblige people to eat, they don't eat. Everyone that had a baby here knows that it's not easy to make someone eat something that is not his desire. So I really believe we have this power of changing and influencing this change that is needed to change, the whole food system. So I'll talk more at the end. Thank you.
Thank you so much, Teresa. We're now turning to Asha Gomez, who is a chef and author of the award-winning cookbook, My Two Souths. Asha? Asha, you're still muted.
Can you hear me now?
Yes, perfect.
Okay. Good morning, ladies. It's a pleasure to be here with all of you. It's an incredible honor. So I'm a chef and a cookbook author, and I cook for a living. I feed people for a living. And so when you have staggering numbers like 690 million people that are chronically hungry, it's an issue that's near and dear to my heart. And even from a personal standpoint, for me, the issue of malnutrition is something that is very personal. I adopted my son from India when he was two and a half years old, and he was 16 pounds, malnourished, distended belly. So I've seen what malnutrition looks like firsthand. And I've also seen what proper nutrition can end up looking like, because I have a thriving 15-year-old boy on my hands now. I've been involved with CARE for a couple of years now, and I traveled with CARE to Peru a few years ago, and it really changed my perception of the role. I'm going to follow in the lines that the chef from Brazil just mentioned. The role that chefs actually play in the issue of food insecurity. I met an amazing chef there who's a very prominent chef in Peru who realized that the only potatoes that Peruvian people were using were the white or the red potatoes. Meanwhile, Peru has 5,000 varieties of potatoes that's indigenous to that region. And yet the locals were not consuming that. He meets with the farmers, he finds out if he can source it. You know, CARE has a consortium that these farmers have formed. There's a collaboration that happens, and the chef now decides to put these amazing potatoes on his menu. And within a span of, I believe, 4 years, the Peruvian potato became a staple diet in Peru. All that to say that chefs really do have a tremendous impact on how people eat certain foods. And even here in the American South, you know, our relationships with our farmers and what we put on our menu can actually change people's minds of what it is they consume at home as well, not just in our restaurants. So from a sustainability point of view, when you're talking about things like trash fish and you decide to put trash fish on your menu, you are now getting people to not just eat one type of fish, salmon or snapper, when there's 1,000 different varieties of seafood that they could be consuming. So that is, I think, one of the most important roles that chefs play, is that our menus can actually change perceptions and change people's minds of what they actually put on their plate in their homes. You know, with COVID, I think, if I'm not mistaken, there's going to be 132 million undernourished people this year alone. And the restaurant industry and the chef world has taken a tremendous hit. What I am realizing, though, is that the pivots that are happening are actually, in a lot of ways, helping local farmers tremendously, because people are now buying directly from farmers. Chefs are starting CSAs where you can pick up food, literally produce from restaurants that you can take home, that we have partnerships with farmers in local areas. And I heard this at CARE a long time ago, you know, all global solutions are local. And it stuck with me. But for me, I think my input on this would be, we as chefs, we're not the ones that are we don't know the stats, and we don't know all the wonkish details like all of you know. But what we have is a very personal connection with the people that consume food. And so we're able to have an impact when we actually voice our opinions on issues that are near and dear to us. And for me, it revolves around food insecurity and hunger. And people actually, we are connected to our communities so closely, because our restaurants and the places that are in the communities are actually central spaces where people gather. And so they pay attention to what we say to them. And that's it. That's what I want to say.
Jada, you're on mute.
Thank you. Sorry. Oops.
Okay.
Thank you, Asha. That was great. In today's panels, our panelists have talked to us about health pandemic turning into a food pandemic, turning into an income crisis that is just able to exploit every social precondition. But our panelists have also talked a lot about empowerment, and especially our last two panelists, ways that they're empowering, decolonizing CSA. So now we're going to turn to the call to action and invite all of our panelists to encourage us and to exhort us to use our voices, as Dr. Kalibata did earlier, and they are going to give us some call to actions to help us do that. So I will start with Ndidi. What's your call to action?
Thank you very much. Pat taught me something a year ago. She said we're dangerous women, which means we have nothing to lose. And my call to action is first that we have to use our voices to be food ecosystem champions. Wherever we can shape policy to ensure that women's issues are addressed in the food ecosystem, we should be bold and courageous to call out inequity. On a second note, we need to ensure that we advocate for shorter value chains. I'm pushing for a policy landscape that sources at least 30% locally and tracks it to ensure that women constitute at least 60% of that local sourcing ecosystem. And if we hold our countries accountable and publish this on a regular basis, I think we'll have something to celebrate as we come out of this COVID-19, building back better. Thank you very much.
Thank you, Ndidi. Jillian, over to you.
I guess my call to action is in every crisis, there's an opportunity. And I think as many governments and development partners focus on stimulus response to COVID-19, we should figure out how we can leverage that energy and that money to target some of the issues that have been discussed today in terms of improving the lives of women in the context of the food system.
Perfect. Thank you. Vicki.
Yeah, thank you. From the Bill and Melinda Gates Foundation, we have a call to action being released tonight in Foreign Affairs magazine. Melinda Gates is releasing her paper about the impact of the COVID-19 pandemic on women and girls. And with this paper, Melinda aims to continue the dialogue begun by our partners, including many of you here, across the gender equality community to create a drumbeat in the media and online to engage leaders, decision makers, and global influencers to take action in 4 areas. First, we have to make sure that our health systems deliver for women and girls. This will save lives now and build stronger, more resilient health systems for the future. Second, we have to design more inclusive economic policies that empower women and create resilience. In many places and for many women, that means starting with the agriculture sector. Third, we have to gather better data, collect, gather, report more and better data about the impact of the pandemic on women and girls. Good data is fundamental to effective policy and budget responses. And finally, we must prioritize women's leadership. For an effective and inclusive response, governments, private sector, all of our agencies must prioritize women's voices at all levels of decision making.
Amen. Christine.
Thank you. My call to action then on behalf of PepsiCo, we would say partnership and collaboration. In order to make a change, we must be willing to stretch our thinking and then partner to co-create solutions. Embracing the partnership will demonstrate the business case for scaling women's economic empowerment throughout the entire food system. Thank you.
Thank you, Christine. Devin.
Thanks, Jada. I would echo what some of my fellow panelists have said. I think this is really the moment to build a bigger, broader coalition around food systems. You know, for too long, at least in the US, food systems advocacy has sort of been left to a group of organizations, a small group, when really food touches everything. It touches health, it touches education, it's a racial justice issue, it's an environmental issue. anyone who's preparing food, as the chef spoke to, have a role to play. Anyone who's buying food, institutions and public programs have a role to play. And I really think asking all the leaders from all of those sectors to join as allies in building a better food system is an imperative at this moment.
Thank you, Devin. Lots of focus on allyship. We should use it in this space. I love that. Maureen.
Yeah, still on allyship and seeing colleagues in the chat box, saying we also have men following this conversation. I really want to call us out to engage men and boys for women's empowerment, especially during this crisis, so that we are able to address all the issues that are coming up around incomes, around household decision-making, and specifically gender-based violence, to apply all the great tools that we have developed at CARE, the gender dialogues that are going to get men as allies to work with us in this movement on women and during the COVID-19 crisis. Thank you.
Thank you, Maureen. Teresa.
Yes, my call to action is chefs, get away from your cell phones and social media, because smallholder farmers, fishermen, and extractivists are waiting for you. And this is my call to action.
I love it. I love it. I won't say it out loud, but I think we all see it. Thank you. Thank you, Teresa. Asha.
So while the economic consequences of this crisis will be temporary, global hunger and malnutrition will carry the legacy of this pandemic forever. But if the world acts now, we can save lives and avoid the devastating generational consequences of a double crisis of malnutrition and COVID-19. And I think for all the panelists sitting on this forum, I encourage all organizations to really start connecting farmers and chefs. It will make a huge impact.
Thank you. Those are wonderful calls to action. I hope we can capture them somewhere and perhaps disseminate. While we have a little time, we've talked about a lot of heavy things, but also empowerment and ways to act. This is addressed to any of the panelists. What's giving you hope right now? You know, as we're mired in the midst of this pandemic, what are the signs of hope you see that keep you fighting and feeling confident that we can turn this around and have greater empowerment than before even? And that's
well, I'll go. I think that what gives me hope is just today, look at all of the amazing voices and people that are on this panel. And I think women in general, and certainly want to include our male counterparts, but we can be comfortable being uncomfortable. As I tell my team, get comfortable being uncomfortable. In order for us to make a change, we have to go into those areas that are hard. And, you know, this is something women do day in and day out. So it excites me that we're not afraid of the challenge. And I believe that we'll step up and we'll come up with solutions that are going to be long lasting and work.
That's wonderful.
Yeah, I have lots of hope for the next generations of cooks and chefs. I teach some young people, and I think they are really different. They are really concerned about the future, and I really have big hopes for them.
For me, I see community coming together like I've never seen it before. I see people standing up that have sat silently in the past and been complacent about issues, that are speaking up against injustices in the world. And this is probably one of the most hopeful times I have seen in my life, just based on the fact that people are willing to stand up for those whose voices can't be heard.
I would add, go ahead, Maureen.
Yeah, I'm extremely encouraged and hopeful by the leadership that we have seen women providing through the crisis. I think it's clear that most of the countries that have women leaders have led in their response to the pandemic, and that goes to give the evidence and the impetus for women's leadership, not through this crisis, but around the world.
Yeah. Devin?
I was just going to add, I'm really inspired by the innovation that we're seeing at the community level. You know, schools that were closed on a Monday and on Tuesday, staff were feeding meals to families and communities out of the driveways and on school buses. And I think similarly with chefs and with food service workers and with grocery workers, I think we've seen really amazing dedication and innovation at the community level that we need to appreciate and raise up and think about how to integrate as we go forward to build back better.
That's wonderful. Anyone else?
Well, this is Vicki. I just want to add that my hope is coming from the young people who just reject the racism and the sexism and the fissures that are showing by economic class, and find it unacceptable that these are the conditions that guide the impacts of inequitable impacts across our societies. And it gives me hope that we will build back better.
Yes, building back better. A big thank you to all of our panelists today. This has been really extraordinary and has given us a lot to think about. I want to reintroduce our host to close us out, Michelle Nunn, Pat Mitchell, and Sunday.
Wow, thank you, Jada. What an extraordinary group of women that we've had the pleasure to hear from this morning. I learned so very much as we heard from the people who are funding initiatives, making policies, suggesting policies, all the way to the chefs who are giving us an entirely different way of looking at our relationship with food. I would just like to say in my closing thoughts that the one thing I'm taking away from this most clearly is that the issue of food is a shared and common foundation. It's not only intersectional with all other global threats, racism, sexism, climate, but it means then that it is up to us and the role of those who are always disproportionately impacted by all of those threats to work together and to see this group of women leaders and our allies who have joined us. I have hope that the next time we convene on food, that we will be a lot further along in shaping some just and sustainable solutions.
Pat, I couldn't have said it better. This has been really an extraordinary panel. I want to thank everyone for their contributions, and I also thank Jada for her masterful facilitation of these conversations. I was just reflecting on the fact that many of you have touched on this, the nexus of these various pandemics we're all facing around the health pandemic on COVID, the pandemic of sexism and of racism, and looking at hunger and all of this. This is a conversation where we together with allies are meeting the moment. This is a conversation I think that has been so inspiring in terms of how each of the organizations separately and collectively are really pivoting in ways that help us to reimagine what a different future can be like for everyone in the world, but particularly for women and girls. And what I am quite hopeful about is the urgency around which we are coming together around this effort and looking not only to institutions and individuals, but as a global community, working together and finding ways for all of us to be helpful. And what I really appreciate about the conversation is the universal nature of the things that we've been talking about, that we are beyond the northern-southern construct, that we are really considering how these issues of hunger and nutrition and health as foundations upon which we together focus on livelihoods around the world are so fundamental to our being, our well-being, and our ability to really thrive in the face of not only this disruption, but knowing that there will be many to come. So thank you. This has been a really terrific conversation, and I know there will be more coming. Pat, I don't know if you want to share what's forthcoming.
Yes, the Connected Women Leaders Group, and again, we hope in partnership with CARE, will be convening forums like this on many of the intersectional threats that we've heard about. And I want to assure everyone who's joined us today that the content of today's forum, which was so extraordinary thanks to our participants, will be captured and made available in several different ways, and we'll be in touch with you about all of those ways. And the one final thing I would say before turning it over to Michelle for what she does so brilliantly, which is wrap up conversations like this, I just want to remind us that the purpose of these forums is not just the shared learning and raising and elevating awareness of the issues that affect and impact all of us, but it is also to encourage each of us to mobilize and activate all of the networks and communities that are represented on today's forum. So thank you for joining us, and let's go out and be engaged as Michelle will now instruct us.
Thanks, Pat and Tunde. So amazing and extraordinary group of change agents who've given us, I think, both food for thought and inspiration for action. I was struck by so many dimensions of this, but one of the most, I would say, elemental is what Sunday brought up, which is that this is elemental. This is universal. We all need to break bread each day, and we can see that this food insecurity is hitting in the most acute ways around the entire world. And I think what I heard some of y'all refer to is the anger, the indignation, the clarity of the inequities that are before us and that have been presented before us are so powerful at this moment. And my hope is that we could combine all of that along with the extraordinary hope and inspiration and energy that I saw manifest, and frankly, the women leadership that was so eloquent today. I feel like somehow if we could combine all of that into a great big stew, we could feed the world. And it would be bountiful and enough. And I think that what we all recognize is that there is the capacity for us to do that. And it is a matter of will and leadership and conviction. And so I leave this conversation more hopeful, but also with a greater sense of urgency around sharing this message. And I would ask, as one of our calls to action together is, how can we lift up the pieces of this conversation to broader audiences? How can we carry that forward? How can we influence policy? And how can we be more powerful together? Because this broad network of leadership, I think, is representative of ecosystems around the world that are fighting for justice here. And we can do more powerfully together. So I hope that we will, and I know that those of us that are a part of this will be thinking about how we turn that into action, and most specifically, how we ensure that we extend these voices and amplify them very specifically through this conversation, but in a broader way as well. So thank you all very much for coming together miraculously, because this is also what women do. We gave back 5 minutes, and so we actually ended a little early. I hope you'll use that 5 minutes to think about what you can do to act based upon the conversation today, and let's go forward more powerfully together. Thanks, everybody.
With gratitude.